My name is Valeria. I'm going to be your student nurse for today. I'm just going to go ahead, close the door so we have some privacy. I'm going to come over here, wash my hands, put my gloves on, and can you please confirm your name and date of birth for me?
Hadley Nelson, August 12th, 97.
All right, great. I'm just going to check out your wristband. That all matches. I'm going to check the NUR. Beautiful. So today we are going to be doing a head-to-toe assessment. Do you have any questions for me about that? Great. So to start out, I'm just going to ask you a few questions. Can you please tell me where we are?
In the hospital.
Can you tell me what time of day it is?
Evening.
What year is it?
2020.
Great. So the person is oriented to person, place, and time. Can you tell me where you went to elementary school?
Bradley Hills.
All right, so I would check that, make sure that I have the right information to confirm your remote memory. And can you please tell me what you had for breakfast today?
Half a bagel.
All right, great. I'm going to look at the I and O's to confirm that, to see that I have the recent memory intact. So to get started with our assessment, I'm going to begin with the cranial nerves. So I'm going to be starting with cranial nerve number 1, which is your olfactory nerve. I'm going to ask that you close your eyes. I'm going to give you something to smell, and you're going to identify that smell for me. So close your eyes, please. And what do you smell?
Sugar cookie.
All right, great. So cranial nerve 1 is intact. Next, we are going to go over the cranial nerve number 2, which is the optic nerve. So I'm going to ask you to stand up. You're going to come and read the Snellen chart for me on the wall. Can you please read the last line that you can see?
A, B, C, D, E.
All right, thank you. You can sit back down. So cranial nerve 2, optic nerve is intact. You have 20/20 vision. We are going to go next to your oculomotor nerve, cranial nerve number 3. So I'm going to measure this by looking at your pupillary constriction. So I'm just going to be flashing this pen light in your eyes. You're just going to look straight ahead for me. Great. And good. So the pupils constrict bilaterally. They constrict to about a 1 millimeter size, so they are getting smaller. And then I'm going to test cranial nerve number 4, which is your trochlear nerve. So I'm going to ask you to look far at the wall, and I look at my finger, at the wall, and back at my finger. Great, so while we're doing this, her pupils are converging and constricting bilaterally. And then I'm also, while I'm here, going to go over the extraocular eye movements. So this is going to be measuring cranial nerves 3, 4, and 6, which is your abducens. So I'm going to be making an H with my fingers. Please follow my fingers without moving your head, just moving your eyes. Great, so all extraocular eye movements were intact. We're going to be moving on to cranial nerve number 5, which is your trigeminal nerve. So during this, I'm going to come and palpate your masseter muscle. I'm just going to ask that you clench your jaw while you're doing that. And do you feel any pain during that? All right, so the jaw is contracting bilaterally, +5 strength on that. And now we are going to go on to your facial nerve. So I'm going to ask you, can you close your eyes, open your eyes, smile for me, frown for me, show your teeth, and puff your cheeks. All right, so she's able to perform all of those movements. So cranial nerve number 7 is intact. For cranial nerve 8, your acoustic, I'm going to be whispering 3 words into your ears. You're just going to repeat them back for me.
Little kitties dancing.
All right, good. And then,
Mango, pineapple, apple.
awesome. We're going to move on to cranial nerve number 9, which is your glossal pharyngeal. I'm going to take my tongue depressor. I'm going to ask that you open up your mouth for me, and I'm just going to go back and hit the back of your throat. Thank you. Perfect. So her gag reflex is intact. We're going to go on to cranial nerve number 10, which is your vagus nerve. I'm just going to ask for you to open your mouth, stick out your tongue, and go ah. All right. So while she's doing that, I can see that her palate is rising bilaterally and the uvula is staying at midline while she says ah. Next up, we have our accessory nerve, which is cranial nerve number 11. I'm going to ask that you shrug your shoulders for me. Awesome. And then please press resistance against my hand. Good. And on this side. So she has shoulder movement and cervical muscle. Her is intact, +5 bilaterally. And then last up, we have cranial nerve number 12, your hypoglossal. I'm going to ask that you stick out your tongue for me. Can you move it side to side? And can you move it against my tongue depressor? Great, and on this side, perfect. So she has all tongue movements are intact. There is no auscultation while she is moving her tongue, and she has bilateral strength for her tongue. So next we're gonna move on to your skin. So right now I'm just looking over all the skin on your body, your front, back, on your back. So what I am seeing is appropriate color for her ethnicity. There's no lesions, ulcers, any kind of masses. When I'm coming down in the lower extremities, I do not see any varicose veins. I'm going to come and palpate throughout. Her skin is warm, non-tender. There's no edema present. And I am just going to go ahead, I'm going to pinch up here really quick to see your skin trigger. So the skin recoils immediately, and there is elasticity of the skin. I'm going to come and examine your nails. So her nails are clean, they are convex, they're about 160 degrees, and I am just going to measure your capillary refill. It is less than 2 seconds. So next up, I'm going to be assessing your head. So just by inspecting it, I see that your head is at midline. It is normocephalic. It has consistent color throughout. I don't see any masses or lesions. I'm just going to come and inspect your scalp. So the scalp is dry. There's no sign of any dandruff. I'm going to come ahead and palpate your scalp. So there's no bony deformities, no masses. Her hair is brown in color. It is shiny. It is equally distributed throughout. So next up, I'm going to be looking at your lips. So just from your lip inspection, I see that they are pink. They are moist. There are no lesions, cracks, fissures on your lips. Can you please open your mouth for me? So I'm looking at her buccal mucosa. It is pink, moist, no lesions or ulcers. Can you please lift your tongue up for me? So now I'm looking at her sublingual mucosa. Same thing. It is moist, pink. There are no lesions or ulcers present. Can you please give me a nice big smile? All right, so she has 32 white teeth. There are no dentures, no fillings, cavities, yellow discoloration. And just do that for me one more time. Her gums are pink. They're moist. There's no signs of gingivitis or any sort of erythema. Now I am going to go on to your nose. So just by inspecting your nose, I can see that it is at midline. I'm going to come and palpate it. Do you feel any tenderness while I'm doing that? No? Great. All right, I'm going to get my pen light out. I'm going to come up and look inside. So looking inside, I see there is no perforation, there's no deviation, there's no discharge coming out, nothing blocking your nose. I can also see her turbinates. They are dark pink, moist, no discharge. And while I'm here, I'm just going to be feeling your sinuses. So I'm palpating your maxillary sinus and your frontal sinus. Do you have any tenderness with that? Mm-mm. All right, beautiful. I'm going to move on to your eyes. So I'm looking at your eyes right now. I see that your sclera is white. Can you just pull down your eye for me a little? So her conjunctiva is pink. Her eyelashes are evenly distributed. I'm going to come and palpate your lacrimal apparatus. So doing that, do you feel any tenderness? Mm-hmm. Good, so no tenderness. There's no tears present coming out while I am doing that. And I'm going to move on now to your ears. So just looking at your ears, I don't see any nodules. I'm going to palpate them. Do you feel any tenderness there along your tragus, any parts of your ear? No? Okay, great. While I'm back here too, I'm actually just going to palpate your mastoid process. Do you feel any tenderness there? Mm-hmm. No? Great. I'm going to look inside of your ears. So I see that they are dry. There is no cerumen buildup. There's no masses, no lesions, and I can see through to the tympanic membrane, which is a pearly color. And next up, I'm going to be performing a few hearing tests on you. So I'm going to take my tuning fork. I'm going to be measuring, the first test I'm going to do is the Rhine test. So I'm going to strike my tuning fork and I'm going to be placing it on 2 spots on you. I'm going to be placing it on near the bone of your mastoid and then in your external ear canal. So I'm gonna go strike it. You're gonna tell me when you stop hearing the noise. Okay.
Can't hear it.
You can't hear it at all?
Or I can hear it, but I stopped hearing it.
Okay.
I stopped hearing it.
Okay, great. So she has air conduction noises are longer than bone conduction. I'm just gonna come and do it on the other side too. Tell me when.
It stopped. It stopped.
All right, beautiful. So air conduction is longer than bone conduction. That's indicative of a normal hearing for the Ryan test. I'm gonna move on to the Weber test. I'm gonna strike my tuning fork. I'm gonna place it on the center of your head, and you're gonna tell me if you can hear it in both ears or only one ear.
Both.
All right, great. So she can hear it in both ears, which means that her hearing is intact. Next up, I'm going to be palpating your lymph nodes. When I'm done, you're gonna tell me if you feel any tenderness through that. So I'm gonna start with the pre-auricular, post-auricular, occipital. And then we got submental, submandibular, tonsillar, and then superficial cervical, deep cervical, posterior cervical, and I'm just gonna ask that you show your shoulders up, great, and then subclavicular. Did you feel any tenderness during that?
Mm-mm.
Great, I did not feel any palpable nodes, so your lymph nodes are doing well. All right, so next up, I am going to be inspecting your trachea. So I'm just going to be palpating your trachea. So from here, I can see that your trachea is at midline. I'm just gonna take a moment to make sure that I have everything in your head region. So I did your hair, face, nose, eyes, mouth, ears, and all the tests. Great. So next up, I am going to be auscultating. I'm gonna be doing an interior thorax examination. So I'm gonna start out just by viewing your respirations. Her respirations are 18 per minute. Her chest is rising bilaterally, equally. There's no evidence of her using any sort of accessory muscles. She's not using her diaphragm. Her nose is not flaring. So I'm going to move on. I'm going to begin listening to your lung sounds. I'm going to ask each place I place my stethoscope that you take a nice deep breath in and out. And I'm going to be doing this with the diaphragm of my stethoscope. So here I hear bronchial, bronchial, bronchial vesicular, bronchial vesicular, 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 vesicular. Great, and then I'm just gonna ask that you turn towards this wall. I'm gonna be doing the same thing on that side, but beforehand, I'm just gonna go ahead, I'm gonna palpate around the posterior of your thorax. There is no crepitus present. Did you feel any tenderness while I was doing that?
Mm-mm.
No, great. I'm also gonna go ahead and measure your costovertebral angle. So I'm just be placing my hands at your 12th rib and I'm going to strike it. You're gonna tell me if you feel any tenderness, okay? Any tenderness?
No.
Great. There?
Mm-mm.
All right, so she has no CVA tenderness. And now I'm gonna go ahead and listen to your posterior lung sounds. All right, so I'm gonna start up at the top where I hear bronchial vesicular, bronchial vesicular, 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 and vesicular. I'm going to move on now and I'm going to begin auscultating your heart. So I'm going to be listening for your heart sounds. I'm going to be starting on your right side. I'm going to be listening with the diaphragm of my stethoscope again to your aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to go ahead and listen to those same areas using the bell of my stethoscope. So again, aortic, pulmonic, herbs, tricuspid, and mitral. And for this part of the test, I'm just gonna ask that you raise your shirt on the left side of your body for me. So I'm gonna be assessing for that apical pulse at the left mid-clavicular line and the fifth intercostal space. So looking at it right now, I cannot see it. So I'm going to go ahead and palpate it. I can feel it on palpation. The pulse is strong, +2, and I'm gonna be listening to this for a full minute. So from here, I'm going to go ahead and start your peripheral vascular assessment. So I'm going to begin at your carotid artery, and I'm going to be listening to, or feeling for your pulse here. So I feel +2. I'm going to do this individually. Good. I'm going to move down to your brachial. I'm going to do this bilaterally. Good. +2. Radial. +2. Posterior tibialis, +2 and strong, and then dorsalis, pedalis, this is also +2. And again, while I'm here, I'm just gonna go up and feel for any sort of edema, which I do not see. There's no swelling, and as I said before, there's no presence of any type of varicose veins. So now I'm going to be getting started looking at your abdomen. So I'm going to ask that you please lay down for me. You can put your head down here. And I'm just going to ask that you bring your shirt up for me a little tiny bit. Alright, so I'm going to start out just inspecting it. So from inspecting it, I can see that she has flat contour, that her belly button is inverted. There is a presence of a belly button ring. It is normal for ethnicity and color. And now I'm going to go on and begin auscultating. I'm going to start in the right lower quadrant. I'm going to do this using the diaphragm of my stethoscope. So I'm going to start in the right lower quadrant. And I'm going to be moving in a clockwise motion. While I'm listening here, I hear soft gurgles and clicks, which indicate active bowel movements. If I did not hear any active bowel movements or noises, I would listen for a full 5 minutes. And I'm going to go on and begin percussing the area. So again, I'm going to be starting in the right lower quadrant. And I can feel resonance in all 4 quadrants. And now I'm just going to go ahead and palpate. While I'm doing this, I'm feeling for any masses, any tenderness. Do you feel any tenderness here? Mm-mm. Great. And I did not feel any hepatomegaly or splenomegaly. So you can now sit up for me, please. So now I'm going to start going over your musculoskeletal system. So I'm going to ask that you bring your neck down, so your chin is down. Good. Bring that neck all the way back. Try and look at the wall behind you. Good. You can bring your neck back. Bring your ear to your shoulder. And on the other side. And now try and look over each shoulder. Great. So her range of motion of her neck is intact. We already tested the strength of her neck during the cranial nerve assessment. So I'm going to ask that you flex your arms out for me. Good. Extend them out. And then give me a nice big circumduction movement here. Great, so the range of motion of her shoulders are intact. Please bring her arm out for me. Press up against my arm. Good, and down against my arm. So she has +5 strength. I would do this bilaterally in each arm. +5 strength in her shoulders for abduction and adduction. We're gonna go on now to your elbows. So can you please bend your elbows for me? Good, and now let them out. So she has full range of motion for flexion and extension. And can you flex them for me one more time? Press down against my arms. Great, and now bring them, and now press up. So she has +5 range of motion bilaterally in her tricep and bicep muscles. And now we're going to be moving on down to your wrists. So can you just bring your wrists out for me? Can you please flex them, extend them? Good, and then hyperextension. Great. I'm going to also ask that you bring your hands back down into flexion. Now press against my hands. Great. So she has full range of motion intact in her wrists, and she also has +5 strength bilaterally in her wrists. And now we're going to be assessing her fingers. So just bring your fingers out for me. Good. Make a fist. Open them up. Fan them out. And then I'm going to ask that you make a fist around my thumbs. Alright, perfect. So she has full range of motion in her fingers, and she has a +5 hand grip strength in both arms bilaterally. So now we're going to be moving down to your hips. So I'm going to ask that you lay back down. Good, and I'm going to ask that you bring your knee towards your abdomen. So that is her hip flexion. Bring it back down, good, just like you're doing. That is your extension. And I'm going to ask that you bring that knee back up. And now make a circle going away from your body. Good. So that is her external rotation. And now with that same leg, make a circle going towards your body. So that is your internal rotation. With that leg, can you please bring it out for abduction? Good. And now bring it back in. Awesome. Adduction. I'm also just going to test your strength while I'm here of your hips. So bring that knee back up like we were doing for rotation. So try and rotate against my leg. Good. So you're going to bring it out. Perfect. And then back in this way. Good. Against that. So we got +5 strength in both hip. We would test for that bilaterally. So both hips have +5 strength. So you can sit up for me, please. Actually, yeah, you can sit up. So can you please extend your knee out for me? And now flex it. Great, so she has full range of motion for flexion and extension in her knee. There's no sign of hyperextension there. And I'm gonna ask that you do the same thing, try and flex out for me, or extend it. Great, and now try and flex. Good, so she has full +5 strength. I would assess for this bilaterally in each leg, +5. And now we're gonna move down to your ankles. So I'm gonna ask that you dorsiflex. You're gonna bring your toes up towards the sky. Great, plant them down like you're on your tippy toes, awesome. Now move your ankle out, eversion, in, inversion. Good, so she has full range of motion there. And then I'm just gonna ask that you press up against my foot or my hand. Good, and down. So she has full strength. We'd assess this bilaterally in each ankle. So bilateral strength, +5, full range of motion. Next, we are going to be moving on to a set of sensory tests. So I'm going to start out assessing your sensory function. So I am going to do this by asking you to close your eyes. And you can open them back up, actually. Thanks. So I have this instrument. This side is soft. This side is hard. I'm going to ask you to close your eyes and identify what side you're feeling. Okay? Close your eyes.
Hard.
Good.
Hard. Soft. Soft.
Alright, great. So she has functions of her dermatones in all 4 quadrants. In all of her extremities. I'm going to next ask you to place your palm out. I'm going to be drawing a finger in your palm, and I'm going to ask you to identify that finger for me, or that number, okay? So close your eyes.
1.
Yes, thank you. So that is her graphisia, that is intact. Next, we are going to be testing your diagnosis. So again, I'm going to ask that you close your eyes, put your hand out for me. You're going to be identifying an object for me. What object do you feel?
A key.
Awesome. So her sternocleidosis is intact. And I am going to go on to test your proprioception. So I am going to ask you to put your finger out. What I'm going to be doing is raising or pressing down a finger. You're going to tell me with your eyes closed which motion I am doing. So close your eyes.
Down.
Awesome. So her proprioception is intact. Next, I am going to be measuring your cerebellar function. So I'm going to ask that you please stand up, walk across the room. I'm going to be assessing your gait. Great, so her, she has steady gait, she has arm swing while she is walking, and the way back, can you just walk heel to toe for me, really exaggerate that movement. Great, so she is able to walk heel to toe. You can sit back down. Thank you. Actually, stand back up. Thanks. So I'm going to be testing your Romberg test now. So I'm just going to ask that you close your eyes and hold your hands out. I'm going to be assessing this for 20 seconds to assess your balance. It looks like everything is good here. You can sit back down for me. Great, thank you. And now we are going to be moving on to your reflexes. So I'm going to take my hammer and I'm going to be assessing your reflexes in your knee. So I'm just going to give you like that. Great, like that. Awesome. And then I'm going to go on to assess your Levinsky reflex in each leg or in your feet. So I'm just going to, perfect. I'm going to start at the bottom, come up towards your toes, and her toes contracted while I was doing this. And again on the other side. Great. So that would be a negative sign. I'm going to ask for you to stand up. I'm just going to come back and observe your spine, inspect it and palpate it. So I'm just feeling, I see for alignment, do you feel any tenderness while I'm doing that?
No.
Okay, great. And then can you please touch your toes? So great, come back up. So I don't see any signs of lordosis, kyphosis, or scoliosis. So you can sit back down for me. And next up, we're just going to finish with some of the neurological tests. So I'm going to ask you to take your fingers, move them like this for me. Great, so you've got the movement in your fingers. I'm going to ask that you meet your finger to mine. Do. Great. I'm going to ask for you to place your hands on your thighs, and we can go nice and fast. All right, rapid movement there. You're going to take your heel, or top of your toes, get a nice stroke up to that shin. Great, and great. So you have those neurological assessments are intact there. And before we get finished up, I'm just going to go through, make sure that I've got everything else going on. So, so I did head, All right, and I'm just going to go back to look at your eyes. So I want to look at your eye placement. So the eyes are aligned. Can you blink for me? Great, so the eyelids are meeting at midline. They're equal bilaterally. And I'm going to measure convergence of your eyes now. So I'm just going to take my finger, you're gonna follow it to, boop. All right, great. So that is the end of our head to toe assessment. Do you have any questions for me? All right, great, thank you. Have a wonderful rest of your day.
Oh, you too.
Thank you.